A new type of coronavirus was recently found in a pneumonia outbreak in central China's Wuhan city.
Really? I didn't know. Actually, I did know. But I'll tell you something here. There's a lot of videos online, a ton of videos online, and very few of them are from people with any medical or nursing background. I happen to be a registered nurse, a proud registered nurse in Canada, and I originally was trained in the United Kingdom, and I'm currently a hospital administrator at a major hospital in the Toronto, Canada area. And I just want to tell people, mostly my subscribers, about some facts and actual reality behind the new threat. So this is a new virus. It's a mutated virus from the coronavirus family. The coronavirus family is known as MERS, which was going to kill us all but didn't, because it wasn't that infective person to person, except in very close contact. And SARS, which happened in 2002 and impacted North America and Europe and even Australia and Mexico in 2003, causing absolute chaos. The estimated death toll from SARS in 2003 was about 800 people. The only reason it was a major deal was that it killed healthcare professionals like me and Kitty. And I still believe to this day that we actually had an infected dose of SARS. But to be honest with you, we didn't go to the hospital at that point because there's no cure and they were using people as experimental animals.
It is a new strain of coronavirus that has not yet been previously identified in humans.
So let's get real here. This is not an apocalypse. The way the virus is mutating, it could wipe us all out. Of course it could. Death's inevitable. Extinction is actually inevitable. What it's almost certain to do is to continue to infect people around the planet over the next few weeks to few months, and there will be outbreaks probably in American and Canadian and European cities, most of which, like Toronto, have a high number of Chinese people living there. Now, I don't want to blame the Chinese for this, but close contact with seafood and poultry is definitively increasing the chance of human infection from animal mutated viruses. The coronavirus actually comes from the bat and then infects, in this case it appears to be poultry. They reckon it was a seafood market, but the seafood market actually also sells live poultry. So this is, again, go vegan.
Coronaviruses are a large family of viruses known to cause illness ranging from the common cold to more severe diseases such as the Middle East Respiratory Syndrome, MERS, and severe acute respiratory syndrome, SARS.
This is also like totally the worst time for this, because this is Spring Festival coming up for China, and Spring Festival is a very important event. Chinese people have to go home, and they have estimated that about 3 billion Chinese people will be moving. So pretty much everybody in the West and Europe and Asia and Australia will travel, mostly by air, outside of China, and quite a lot inside of China, to go home for the holidays. And that's great, but about 3 billion separate trips going on. There isn't 3 billion Chinese. So that's a lot of people moving around China. So it started in Wuhan province, which is in central China. I'd never heard of it, you probably never heard of it. Its major city has over 11 million people living in it. That's pretty big. And there's been around about 9 people have been recorded as dying from it. Most people have flu from it. Some people get a little sicker than that, and some people get very sick and die. That's pretty much what SARS did. Now, what does this mean for you as a prepper? Now, I haven't watched any of the videos other preppers have put out there because, frankly, I'm not that interested in them. I prefer to get my medical and nursing knowledge directly from the sources, the CDC, the World Health Organization. Now, anybody out there that says the CDC and the World Health Organization are part of the shadow government and are just sending lies out is an utterly crazy person, and good luck. What I can tell you is that all across the planet right now they're building, in case of Heathrow, England, they're actually building a separate arrivals terminal for Chinese people out of China to actually segregate and test them. And the testing basically is asking a bunch of questions. Did you go to Wuhan province recently? Do you farm there? All that sort of thing, and they might segregate them. They're also going to take temperature. This is all to do with controlling the epidemic, which is not yet an epidemic or a pandemic. However, It takes 5 to 6 days to show a temperature spike, and what they're not saying is quite a few of the cases in Wuhan, especially the sicker ones, have had no temperature spike. So it's not very good. The only way to quarantine a disease from spreading is to stop people moving. And we're not doing that because that would affect the economy.
Common signs include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties.
Now, as you can see from this slide, there's a lot of things the Chinese are expected to do on Spring Festival, and most of it involves moving around, and that's one of the problems, is that you can't quarantine people who are moving around. But it gets worse, and this is not being covered at all. The Chinese, traditionally, are very superstitious, and they're very careful, and they have superstitions related to Spring Festival. These superstitions will not help quarantine the disease. One of the major ones that they have is do not take any medicine at all during this week, because if you do, you might be sick all year round. Okay, think about that. They're not taking any medicine, and they're traveling en masse, and they're in close quarters while they travel. So yeah, this is going to be a problem. It's also a problem because you can't look at it and go, oh yeah, they've got it, because a lot of people have colds and flu at this time of year. I've just had one, and Kitty's just had one. What I would suggest people do is not overreact. This will not probably develop into the ending of civilization that some people might be claiming online. What I think this will do is I think it will actually cause a sort of SARS outbreak. I think we'll probably be looking at about 1,000, maybe 2,000 people dying in China, and probably half that many or quarter that many around the rest of the world. I can't say that with any definite proof, but that's what it looks like. The death toll in China from a very serious pandemic at this point would be immense. It is at least 9, it's probably higher. There's been some research done. When the Chinese said there was about 200 cases, some scientists actually looked at some statistics and made a guess about how many the actual cases were, and they figured about 1,700. So whatever the case measurement is being recorded, factor in about 5 to 6 times that. It's worth thinking about. So what should you do? What should you do to protect you and your family from this latest threat?
Maintain basic hand and respiratory hygiene and safe food practices, and avoid close contact when possible with anyone showing symptoms of respiratory illness such as coughing and sneezing.
Well, don't travel by air. Don't go on a cruise. Don't travel on a train. Don't travel on a bus that's crowded. If you do, wear a decent face mask. Put it on properly. Done videos on that. Don't put it on like everybody does and have it like down here. Pointless waste of time. If you're going to wear the face mask, wear it and seal it. Wash your hands and consider getting in some basic materials that might help you if it becomes an extremely serious outbreak. I've done videos on this, the specific types of antibiotics that you can get for pets that will treat secondary pneumonias on top of a viral infection. There is no treatment for viral infections. People are all going on about little herbal remedies. Trust me, none of them will keep you alive if you get a viral infection that spreads systemically. You will die, or you will be maintained alive until you die. I think the modern healthcare system we have is going to stay intact. I don't think it's going to collapse. Elective surgeries might get cancelled, so if you're actually able to pay for your surgery because your government doesn't pay for it, or you're given the option, I'd actually have your surgery elective done sooner rather than later this year, because it might actually not be done for you, like a hip surgery or a knee replacement. If they get the offer to do it 2 weeks from now, I'd say yeah, I wouldn't wait 4 months. This is either going to fizzle out much like MERS did, or it's not. The reason I don't think it's going to fizzle out like MERS did is we have cases now in America and other places. It's popping up, and that would definitely, to me, suggest that although they said there was no human-human transmission, they then said that there is maybe some human-to-human transition. There is human-to-human transition, and a significant number of the healthcare workers in Wuhan province have come down with this, about 18 to 19 of them, one of whom is critical. So the odds of getting it are low. The odds of getting it in a way that's going to make you very, very sick are really low. The odds of dying from it are very tiny. You're much more likely to be killed crossing the road driving the car to go to McDonald's. But that's not how our world works, is it? News will focus on this. Any death in North America, any death in Europe will be reported ad nauseum. I can tell you the healthcare system in Canada is under immense strain now, without any particular large spike in normal flu cases. We don't have any beds most of the time. Emerge will have 40 patients down there quite often these days who are admitted but don't have a bed in my hospital. Our Emerge is designed for 43 patients total. It's quite critical. We don't have investment in our healthcare facilities. We don't have trained and experienced staff. What we do have is a bunch of people like me and Kitty that went through SARS and are sitting here and going, I'm not altogether sure I'm going to bother going through this again. I do know what I need to do to protect myself, and that's total barrier. Not a yellow mask, not a yellow gown, but a strongly fitting N95 mask. And this is the crucial bit. And they'll tell you don't need this. They're talking garbage. You need to wear glasses. I've often said to people, even if you've got great vision or you've had laser corrective surgery, when you're out and about in the public, specifically when you're visiting hospitals, have clear glasses on. It's not a full sealed barrier. If the virus is airborne, it will go in the eye and it can infect you that way. So if you're actually nursing somebody at home who you believe has this virus, you need to put sealed goggles on. But generally speaking, these get very, very filthy by people spitting when you're out and about in public, and you really want to consider protecting your eyeballs as well as your face. And if you're going to wear a face mask, keep your hands off it. People do this all the time, and you're actually making it more dangerous than if you didn't have one and you were taking care.
With the current virus, we have limited human-to-human transmission.
So we have a new virus, we have human-to-human transmission, we have a death rate, we do have 3 billion Chinese people moving, not all 3 billion Chinese people, but 3 billion movements happening between Chinese people. A large significant proportion of them will be coming into Canada and America and Australia and Europe. There is a definitive chance that this will be a repeat of SARS in 2002, but specifically SARS in 2003. So what am I going to do? I'm a healthcare professional, so is Kitty. What we did in SARS is we quarantined ourselves voluntarily for about 6 months. By that, what I mean is we didn't go to the mall, we didn't go to the gym, we didn't go over to the family, we did nothing. It was a tough time. Initially, when patients were coming in at Kitty's hospital, which I now work at, and then when they incorrectly treated them and ignored medical directives, so the doctors endangered the staff, and they were never fired, because who fires doctors in our society? They actually infected people I know and like really well, and some of those people never returned to work. Thankfully, none of them died. And I experienced stigma at my other hospital because Kitty was working at a hospital that had infected its ICU with SARS. And then we started to get SARS patients en masse. And we used full spacesuits for them. Kitty's hospital didn't. You can't protect yourself unless you're completely isolated and sealed respiratory from other people. The mask helps, it's not an absolute guarantee. So China has made this a Class A disease. China authorities will now quarantine and lock down anybody in anywhere they want to for as long as they want to if they believe there's evidence of this virus there. Now, if you can afford it, you want to get yourself a set of N95 masks, and you want to get yourself some vinyl gloves, and you might want to get yourself some painter's suits as well as just general gowns to wear to protect yourself, and maybe some swim goggles in case you need to look after people at home. You want to get a viral agent like Virox that's a wipe, kind of like Clorox. Clorox will do anything to wipe down the surfaces. And if you're worried about this, you want to get them today, not next week or the week after or the week after that. It's much like smoke hoods. It's best to buy a smoke hood before the wildfire season starts, though we have a perennial wildfire season around the planet now, because otherwise the price goes up and the availability drops to zero. Face masks are reported to be zero available in Wuhan province right now. Again, exacerbating the problem, making spread more likely. Now, if you're really paranoid, don't travel to Washington State because they had one case. So the problem with this is there's one case, but there may be other cases, and you've all seen the graphics. 1 dot, 5 dots, 25 dots, dot, 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 everybody's dead. Probably won't work that way. What happened with SARS, it became less infection as time went on, and hopefully this will do the same thing. Viruses tend to act within the family the same. So it's probably going to be like MERS and SARS. I think that's what we should be prepared for, and I don't think you'll have any particular problems using normal life in almost all of the United States, Canada and Europe. Some places like Toronto, when we got hit, yes, there will be a major disruption in healthcare and transport and entertainment. Bars will be shut. So you might want to stock up on your alcohol. This is a novel 2019 coronavirus. It's called novel because it is brand new. There is no specific medical test for this. There is no cure for this at present. There is no vaccine for this at present.
There is no specific treatment for disease caused by a novel coronavirus. However, many of the symptoms can be treated, and therefore treatment is based on the patient's clinical.
The speed of identification was a lot faster than there was in 2002 with SARS, so that shows that the World Health Authorities have actually beefed up surveillance and decision making when a new virus appears. So that should make people feel a little bit more reassured. Very good. I actually recommend you go vegan. Yeah, symptoms can be treated, but when you get bacterial pneumonia on top of it, and when it goes into the bloodstream and organs start to shut down, death will occur. Death is an inevitable part of life. Let's get real here, people. There's been 9 people have died that we know of in the world today. SARS was a massive thing for those people that remember it, and it was about 800 died. Even if it was 8,000 deaths from SARS, on an individual level it's tragic. It was massively impactful for me and Kitty. But let's get real. Far more people are dying from avoidable causes, like motor vehicle accidents because people drive very aggressively and stuff like that. So keep it in proportion. So use this opportunity to beef up your pandemic supplies, your household water and food storage and heat and cooling ability if the mains go off. I think that's highly unlikely. Even at the peak of SARS, we still got deliveries coming into Toronto. But like I say, if the 800 people, 200 I believe in Toronto dying from the disease, what you end up getting is fear. But if it's like 20,000, 30,000 people in a city like Toronto start dying, then I think you might see a disruption in truck service. So that's it. I don't think the world we know is about to end because of the novel coronavirus. I don't think that you or me are going to die from it. I'm at way higher risk than you are, working in a hospital in a place like Toronto with a large Chinese population. But I still don't think it's really worth bothering too much about. It's certainly not a major critical issue. Certainly the Iran-American conflict is way more likely to be impactful on you than this is, depending on what happens and where it goes. It could of course always mutate, and it could also become extremely lethal and very spreading. But that is true for absolutely every single virus we have. Now there will also be a lot of people out there rumbling on like they always do about Agenda 21. I don't know what they're going to do in 2022, but they'll be rumbling on about this has been fixed and this is done for this reason and that reason. Honestly, if there is a shadow government and they want to kill large numbers of us, this is not a very effective way of doing it. So don't worry too much. Do have a think about your pandemic supplies. Self-promotion, but I have a bunch of stuff online about dealing with pandemics. I even have a pandemic series showing a very bad case. And I also have a few stuff on how to use pet antibiotics and stuff like that. So poke around, have a look, have a think. Maybe spend half an hour to an hour this week and think about how prepared you are to deal with an infectious outbreak that is lethal to a tiny number of people but causing huge effects in the place you live. If you really want to get into prepping, think about what you would do if we lose 15% of the population over a 4-month period of time, because we will at some point. I just don't think it's going to be from this virus. I could be wrong. Anyway, toodles! That was a Bad Terrier 2020 production.